everybody. Welcome to the Thundermist Virtual Baby Shower Series. My name is Michelle Blade Mello. I'm a family nurse practitioner as well as a certified nurse midwife, and I'm here today to help guide this baby shower. So today we do have Dr. Sara Delaporta, who's going to be here to discuss about how to navigate the fourth trimester, which we focus on postpartum care, we focus on stress, and these new changes in our lives. The fourth trimester is really considered the 12-week period immediately following the birth of your baby. During this time, babies are learning to adjust to life outside of the womb, and not everybody is familiar with the postnatal time period, but every patient and their newborn will experience it. So the Thundermist prenatal care providers are here to help answer your questions. This is a live event, so if you do have any questions, please make sure you're typing them in the comments during the live stream, and we'll do our very best to answer them at the end of the presentation. Now, before we begin with our question and answers, Thundermist would like to recognize Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. Thank you so much for making this virtual series possible. So we're excited to have one of our baby shower sponsors here with us today, and that is Rosemary from Neighborhood Health Plan of Rhode Island. She's here with us, and she will explain how you can enter to win the grand prizes. Thank you and welcome.
Rosemary, you're on mute.
Yeah.
Thank you. So thank you. Hi, I'm Rosemary O'Brien. I am a health and wellness specialist at Neighborhood Health Plan. And what I'm going to do is tell you how to get your prizes, how to register for the grand prizes. So you need to attend all of the, you know what? I'm so sorry. Just get that in front of me. So you need to attend all the sessions. You need to, if you look in the chat, we're going to put the link to register. And I'm sorry, I don't have the information in front of me. I thought I did. So I apologize.
But it looks like there is a link right at the bottom of the screen that you can click on that you will be able to enter to win one of the grand prize rifle items.
Great. Thank you so much. I appreciate it.
And then we also have Judy.
Hello, everyone. My name is Judy Cepeda. I am one of the sales, marketing, and outreach representatives with Neighborhood Health Plan of Rhode Island. And I just wanted to say congratulations to all the expecting moms. I know this is a special time for all of you. And I also wanted to thank Thundermist for having us on, and also to thank the staff for all of the support and care that they bring to give to our community members. And I also wanted to just quickly go over the plans that we have for expecting moms and families, in case you might require some information. But Neighborhood Health Plan offers two different types of plans for families with children. The first one is called Access. The Access Plan is one of our programs through the Right Care Medicaid program through the state of Rhode Island for families and children. You do need to meet certain requirements in order to qualify. Our second plan is called the commercial plans, which you can purchase through Health Source of Rhode Island if you do not meet the requirements for our Medicaid plans. And this is a plan that you can purchase through Health Source of Rhode Island. And you may also qualify for tax credits or discounts to help you with your monthly premium. Either plan that we offer, you will have access to our large network of doctors and specialists throughout the state. We're contracted with every community health center, for example, Thundermist, to assist you with all of your healthcare needs. We also are contracted with all the major pharmacies in the state of Rhode Island as well. One important message that I did want to mention to all of our expecting moms is that if if you have any changes in your family size, address, or income, to please contact Neighborhood Health Plan of Rhode Island as well as Health Source to keep your information up to date. You do not want to miss out on receiving your new baby's ID card, benefit information, or other important details regarding your plans. So again, it is very important to keep your information up to date. There's a lot of other benefits and services that we offer. So if you are interested in more information, please see one of the navigators at Thunder Mist, or you're always welcome to contact Neighborhood Health Plan of Rhode Island, and we'll be more than happy to assist you with any questions you might have. I would like to take the time to turn the mic over to Rosemary so she can talk about our benefits and rewards that you can receive as a neighborhood member. Thank you.
Thank you, Judy. So I apologize. I just want to backtrack on registering for the grand prizes. I thought I had it in front of me and I didn't. So you need to watch each session, live or recorded, to get the link to enter our grand prize raffle. As I stated, the link will be posted in the chat. We'll share the link in the comment section as well. Viewers will have until Sunday to enter to win, and the winners will be notified by Tuesday. So there are the facts. So I wanted to just quickly say that neighborhood has 2 pregnancy programs. One is called Bright Start. Anyone who is a neighborhood member and is pregnant is automatically enrolled into Bright Start, which means that they will get a packet of information from everything to having a healthy pregnancy to postpartum care. If someone has a high-risk pregnancy and they're in need of a medical case manager, that is available to them as well. And you can earn a $20 Visa gift card for completing all the recommended prenatal visits, and then a $20 gift card for Visa as well for getting your postpartum exam between 3 and 8 weeks after delivery. And then Neighborhood is partnered with a program called Luna U. Luna U, you need a smartphone to participate in Luna U because it's a platform, but it is a personalized well-being program. You have access to a well-being coach, informational sessions provided by experts. You can connect with other Luna U pregnant moms. And you also get a blood pressure cuff and a fitness tracker, which will track your steps in your sleep. Luna U is not intended to be a medical program. So, you will get information on how to use a blood pressure cuff, but that always goes back to your medical provider. This is support. This is not a medical program. And what I'll do is I'll put the Luna U neighborhood website in the comments. And then I just wanted to let people know that Neighborhood does have a member rewards program, which means your children, your family, if you are on Neighborhood, you're entitled to get gift cards to Walmart, $25 gift cards for completing certain health behaviors. And I'll just quickly go through them. And this is for Medicaid and commercial members. The 18-month well visit, if you bring your child for the 18-month well visit, if your child has all their shots by their 2nd birthday, if they have a lead screening test by their 2nd birthday, anyone age 3 through age 64, if they have their yearly physical, if someone has asthma and they do an asthma action plan with the doctor, if someone has diabetes and they have a urine test, a blood pressure and A1C blood screening test, they can get a $25 gift card if they're over 40 and they have a mammogram, or if they belong to a gym or a fitness facility for 3 months or more. And you can go on our website and get more information about the member rewards programs. Just wanted you to be aware that you and your family may be entitled to get gift cards. So I will now turn it back to the providers at Thunder Mist. Thank you so much.
Thank you so much for all that information, Rosemary. I appreciate that. Okay, so why don't we get started? Today, like I said, we have Dr. Delaporta, who's here today. Dr. Delaporta, why don't you introduce yourself?
Thank you, Michelle. Hello, my name is Sara Delaporta. I'm a family doctor here at Thunder Mist and one of our prenatal care providers. And I'm here today to talk with Michelle about the 4th trimester.
Great. Thank you. And my name is Michelle Blade. I am a family nurse practitioner as well as a certified nurse midwife. I'm also on the prenatal team at Thundermist and excited to take care of you. Okay, so let's talk about the fourth trimester. Now, in this talk today, we are going to be talking about the fourth trimester. However, if anybody has any questions about any area of pregnancy, please feel free to put it in the chat and we can talk about it. So the first thing I'd like to talk about is, why is the fourth trimester such an important time for parents and the baby?
Yeah, so like Michelle mentioned before, the fourth trimester is considered the first 12 weeks after a baby is born. And I actually love that we gave it a name, the fourth trimester, because I think it draws some really important attention to that time period. There's a lot of excitement and attention around pregnancy and education around pregnancy, but I think the fourth trimester is an area that needed a little increased enthusiasm to acknowledge all the learning and growing and work that goes into it. The fourth trimester is a critical time for learning about baby and figuring out how to take care of this whole human, which is really a lot of things. I think, your healthcare provider can be there for you to help you learn about feeding and sleeping and baby care. What are signs of illness and what are normal things that may look really weird but are normal. I think a lot of parents will feel like they just got it figured out and then something changes and they have to figure it out all over again. So there's a great deal of joy in the fourth trimester and learning, but also some real challenges that are really important to have someone there for you to get through. And that can be your healthcare provider, but also having a team of, a partner or a parent or a friend or a sibling who maybe has experience in caring for a newborn can be a really helpful support as well.
I agree. Or all the above. If you can have as many people there to help support you as possible, that really makes a big difference in that those first 12 weeks after you deliver. So now, let's say a parent who is pregnant happens to have a substance abuse disorder. How are we at Thundermist able to help with that?
It's a great question. I think there can be a lot of sensitivity around this topic, especially in pregnancy. I think something special that Thundermist brings to the table is treating this in a non-judgmental way and recognizing that this is a medical diagnosis and not something to be judged and not a weakness or a failure. So that's kind of the starting place that we come from, which I think is helpful and important. Our providers here are trained and equipped to support people with medication if they need medication to treat their substance use disorder. One of those medications is Suboxone, but there are other medications as well. We also have substance abuse therapists here, nurse case managers here who are really helpful in our patients' care. And then another sensitive area that I think we're great at addressing is expectations for the parent. Particularly expectations around things like custody and DCYF, which can be really hard topics to dive into. But I think knowing what to expect ahead of time is a really respectful way to approach this illness. And lastly, the care of the baby. So if a parent is struggling with substance use disorder, there are two bodies that are dealing with that diagnosis. And knowing how to care for the baby after that pregnancy is a unique skill set that we're ready to provide.
I absolutely agree. Yes. Okay. Next question is, now, right now it's summer, so we don't see a lot of colds and flu. We are seeing some COVID though. What is the best way for a family to stay safe after bringing home the new baby?
Yeah. I think the most of the time when I get this question, probably the same for you, Michelle, it's usually around illness. Yes. And so illness is one thing I thought about when, preparing for this question. I think the best thing we can do is ask sick family members and friends to not come. And that is a hard thing to do. But when you frame it for the baby, like my baby's not, they're too young for us to be wanting to deal with an illness. Please come visit another time when you're feeling fully well, is usually something people are very accepting of. So I would say if there are people that want to visit, ask them only to come if they're not sick. And then when they're not sick, everybody should wash their hands. Some other things about safety, I would say, that are not illness related, but equally important, are not smoking around babies, making sure babies have a safe sleep environment. So that would be like a crib or bassinet or pack and play with a nice firm bottom, and then not a lot of fluffy stuff around them. So not stuffed animals, not pillows, not blankets. And then another critical piece to safety, I think, is asking for help. I say to all of my patients at their baby's first several visits, there's no dumb question. So if you think your baby has a startlingly worrisome case of the hiccups, call us. It's okay. Or if you see a scratch and you're just not sure, call us. There's no silly question. Our brains are really tired when we're trying to care for newborns, and they're small and fragile. So it's okay to call with any question, whether it's a huge question or a tiny question. Asking for help is always acceptable.
Absolutely. And I think another great thing with Thundermist is that we actually have providers that are on call 24/7. So if it is after hours and you are concerned about the hiccups or a scratch on the newborn, feel free to give us a call, because there is somebody on call 7 days a week. Okay. Adding on to that, Sarah, I thought of a couple of other things. One is Tdap, getting the Tdap vaccine.
Great point.
Not only for the mom, but for whoever else is going to be around the baby. So we know Tdap is a tetanus vaccine, but it also has a component of it of pertussis. And pertussis in you or I would cause a cold. However, for a baby, it could be devastating. So we do suggest that mom and partners and grandparents and anyone that's going to regularly be around that baby to get their vaccine right around the time mom is about 28 to 30 weeks pregnant. That way it's going to kick in by the time baby's born. One other added addition too that I had with the sleeping, I absolutely agree. Make sure there's nothing soft and fluffy around the baby. Also, make sure the baby's not sleeping in the swing or sleeping in the car seat. That's another thing we tend to think, oh, look, they're so comfortable there, but really it's not very safe. So I always suggest moving the baby to a bassinet or a crib, always sleeping on the back. All right, next question. Should pregnant people get the COVID vaccine, or should they wait until the baby's born?
It's a great question. And I think if this question was asked when the vaccine was first available, I would have a less robust answer for you. But now I think we can robustly and confidently say, yes, pregnant people should get the vaccine. There have been tens of thousands of pregnant people vaccinated, and we've seen no increase in side effects or negative effects of the vaccine in pregnant people or newborns. On the flip side of that, we do see an increase in COVID complications in pregnant people, especially that are unvaccinated, such as needing the ICU or having babies early. So those are things we really want to avoid. And we can now confidently say the vaccine is a safe and effective way to avoid those things, and we should use it in pregnancy. And we have tons of organizations backing that up, including the CDC and the FDA. But separate than those two, we have the American Academy of OBGYNs, and we have the Society for Maternal Fetal Medicine that all recommend getting the vaccine in pregnancy. To Michelle's point before, in that kind of creating a bubble around baby, the Tdap is a great thing to think of for family and friends that are going to be around baby. So is the COVID vaccine, and when seasonally appropriate, the flu vaccine.
Absolutely. I agree. And not just for mom, but for everybody that will be near mom and baby. So it's a great thing to talk about the people that are around you to suggest getting those vaccines also. So how would you suggest handling stress and fear about the baby getting sick or us getting sick?
Yeah, that's a hard one. And I think, we want to control everything, and we simply can't. So I think doing the things we mentioned above, like vaccinating, and like asking anyone who's sick or not sure if they're sick to just visit a different time, is important. Basics like hand washing, after you get back from the grocery store before you handle your baby, is a very helpful thing. But also recognizing there's some things we can't control, like your 3-year-old gets a boogery nose when you just brought the newborn home. We can't control that, and there's no perfect way to manage that. So I think controlling what you can control by not having sick people come over. But if your, older child is sick, those are things that are out of our control. So recognizing we're going to do what we can do, and then what we can't do, we're just going to respond appropriately as it comes, because we can't bear all that burden on our shoulders. So, if you have a worry that your baby is sick, call your healthcare provider and let them guide you. And then the prevention things that we mentioned before, like vaccination and hand washing and keeping ill family or friends away for now, is, I think, the best things we can control.
Perfect. Great. So another question is, what if a patient is concerned about postpartum depression? A lot of talk about this, a lot of talk in the media about this, a lot of talk around, which I'm very happy that this is starting to come out and starting to really be at the forefront, and so people can recognize it. But what can we look out for? What can patients look out for, and when should they ask for help?
It's a great question, and I share your sentiment. I'm really glad that this is no longer a secretive or thing that we thought was rare and blamable. Postpartum depression is real, and it's important for us to take care of it. So I think it being on people's mind is great. And having partners or family or friends know, like, oh yeah, we should think about that in this 4th trimester. We should keep an eye on this parent and make sure we're not seeing signs, is a helpful thing. I think in people that have a history of depression or postpartum depression, we want to keep a closer eye and stay ahead of it, and know that if we've had it before, there's a chance it could come again. And so having a closer follow-up visit with your primary care provider can be a great thing. Or connecting with a therapist before you deliver can be a great thing, to stay ahead of it and maybe avoid it altogether, or get it before it gets to be really troublesome. Things to look out for can be feeling down, feeling hopeless, not enjoying things that you used to enjoy, having low energy, which is a tough one because you have low sleep too, but disproportionately low energy, thoughts about hurting yourself, thoughts about hurting others. Those are all things that, we don't want to just keep inside and push away, but rather reach out to someone that you trust, whether it's your healthcare provider or your partner or your friend or your parent, and then accept help.
Absolutely.
We talk about baby blues as a short-term, not burdensome emotional change that can happen shortly after baby's born. That might be like a little tearful or a little sad, or motions that are feelings that don't kind of go along with the setting you're experiencing. And if it's mild and not getting in the way of life, it's okay to let it pass. But if it's severe, or it's standing in the way of doing what you need to do for yourself or your baby, or you're worried, then that's a good sign to reach out.
Those are great, great points. I also would love to point out the fact that also postpartum anxiety is a big problem too. So some people think, well, I'm not depressed, but I'm afraid the baby's going to somehow fall out of the crib, or things that really get very anxious about, even though it's very unlikely that these things will happen. So that's another sign of postpartum depression and anxiety, that it would be great to reach out. Sara had a really great point of getting set up before the baby's born, getting set up with counseling. Even if you've just had some depression in the past and never postpartum depression, there are so many changes that happen in the 4th trimester that it would be a really great idea to just reach out and get this set up, because once the baby comes, that's just one less thing that you need to set up, one less thing you need to do. It's great.
Yeah, postpartum anxiety is a really good point. Less well recognized than postpartum depression, but
Absolutely.
equal burden.
And I would like everyone to know just how common this is. It's so common. I feel like patients who come to me sometimes feel embarrassed about it and feel like they're the only ones out there with this. You're not. It's very common, and it's really great that you're reaching out and getting help. It's very important. Let's change the subject a little bit and talk a little bit more about feeding. So they're just wondering about the different options of breast/chest feeding. If somebody was interested in just doing it for a short period of time, what kind of resources are out there for parent and baby?
Yeah, that's a great question.
Mhm.
So I'll tell you a little bit about the supports that are out there in general, and then about length of feeding and a couple of nuances. Breast or chest feeding is a great option for baby and mom in terms of health benefits. But a lot of people think because it's natural, it's easy. And that is the trick. It's not easy. There's a lot of learning that has to be done for both baby and mom about how to make this work. The length of breast or chest feeding is something that we say is up to the pair. It's up to the person that's doing the feeding and the person that's doing the eating. And both people can, the baby's obviously not going to say, but both people can show us when it's time to continue and when it's time to end. And whether that is, how you feed your baby for a week or for a year, is up to the pair. And we're here to support the pair to meet their goal. So we aren't going to tell you breast or chest feed for 6 months or a year or 2 years. We're going to say, how long do you want to breast or chest feed? And then we're going to ask you, is that still the same answer a couple months later? And we'll help you meet your goal. I think some important piece of advice are to, one, know that it takes some learning. It just because it doesn't work at first doesn't mean it can't work. Two, I think it's a good idea to get some basics before baby is born. And that can happen with a lactation counselor. That can happen with a class. That can happen with a book. And if it's your first time breast or chest feeding, I think getting some basics beforehand can be really helpful. Number two, getting some help right away afterwards is really helpful. So I think my biggest point to someone who's a new breast or chest feeder would be, if you're having trouble, don't wait. I think the success of feeding this way is really dependent on getting help quickly, because the longer we wait to troubleshoot, the longer that path is to success. Making milk is dependent on removing milk from the body. And so if we're not successfully removing it, our body's not going to get the message to make more. And then we run into trouble with supply. So ask for help soon. Don't tough it out is my number one piece of advice there.
I think that's really great. And Thundermist actually does have a lactation consultant on staff. So if you're having problems and you're having difficulty maybe getting in with the lactation consultant at the hospital, Women and Infants Hospital or Kent, or wherever you decide to deliver, you can always call us and we can get you set up with our lactation consultant. Even if it's a one-time visit or numerous visits, we are definitely here to help you.
Yeah, those are great resources at Thundermist. And Michelle also pointed out both Women and Infants and Kent, and I assume Landmark, have lactation consultants that you can meet with. And then various home visiting nursing agencies also have support there. So there's lots of ways to get help. We want you to have it quickly.
Absolutely. And yes. And with the home health nurses, they come right out to the house to help with the lactation consultant, or you go to the facility. So there's a lot of resources. You just let us know what your comfort level is and where your interest is. So as far as follow-up visits, so now once the baby's born, when should the baby's first visit be?
That's a great question. Babies have a ton of visits, and this is expected and important. It may seem like we do a lot more talking than examining at the first couple of visits, which is probably true, because a lot of those first few visits are about learning how to care for baby. So the first visit will probably be within 2 to 3 days of getting home from the hospital. The next visit may be shortly after, or it may be a little longer, depending on how you're feeding your baby and how well they're doing with their growth. Usually, I think a common pattern will be like 2 to 3 days, maybe a 1 week old visit. And then that one's kind of a plus or minus, but then a 2 week visit, a 1 month visit, 2 month visit, 4 month visit. And all those visits are important for us to look at baby's exam, baby's growth, baby's development, and then guide you on different changes in baby care that happen along the way, as well as troubleshooting any questions for you.
Great. And of course, these are the standard visits. And of course, if you've got any questions or concerns, we'll be happy to see baby in between any of those visits with any questions or concerns. As far as if a mother is deciding to breast or chest feed, would you counsel on continuing the prenatal vitamin? And also, what is your thoughts on birth control while breast or chest feeding?
Great question. The prenatal vitamin, yes, you do want to continue it while you're breast or chest feeding. All those nutrients that were important for baby while you're pregnant continue to be important to put into your breast milk. And actually, when you're making human milk, it requires a lot more from your diet. And a lot of us don't keep up with that perfectly. We may keep up with the extra calories, but keeping up with those micronutrients is tough. So taking the prenatal vitamin is very helpful when breast or chest feeding. And you want to continue it through your entire breast or chest feeding journey. And then you can stop it unless you're planning for another pregnancy, in which case you start it again. The birth control question is a really nuanced question and has a lot of it depends answers, depending on a person's, chronic health conditions, how they're feeding their baby, how their pregnancy and delivery were. So there's a lot of personalized decision-making in birth control. The short answer that applies to everyone is, if you are having sex and you don't want to be having a baby, it's time to think about birth control. Condoms are acceptable anytime. And then there are plenty of methods that we can start even before someone goes home from the hospital for pregnancy prevention. That includes things like the shot or Depo, Nexplanon, which is the implant that goes in the arm, or for some people, an IUD right after delivery. Those things are also acceptable in the postpartum period or at the 4 to 6 week visit postpartum. And then things like the birth control pill, patch, or ring, usually we delay to 4 to 6 weeks. But again, that's a conversation dependent on you individually. So it's really great to be thinking about birth control. And it's one of the topics we pay close attention to in the 4th trimester. Personalizing that decision between you and your healthcare provider is a great idea.
Right. And I think it's always a good idea to, even before the baby's born, your provider will probably start talking to you about how you would prefer to feed your baby. What type of birth control would you like to use? Who would you like to use as a pediatric care provider? So these are things that a lot of your OB provider will be discussing with you throughout the pregnancy. So that way there won't be any surprises whenever baby's born. Yeah. Okay, great. So I wanted to thank you for coming today, Sara. I hope everybody out there has enjoyed getting to know Dr. Delaporta and I. I wanted to thank our sponsors. I don't see any questions in the chats right now. But before you leave today's session, be sure to enter to win one of the grand prizes. You can click on the link that's right below our pictures to enter for the grand prize. And today's session will be recorded and available for future viewing. So if you're interested, you can always watch us again. Thank you to Neighborhood Health Plan and United Healthcare Plans of Rhode Island, Tufts Health Plan, Landmark Medical Center for generously sponsoring this virtual series. And if you're interested in having prenatal care, ThunderMist does offer care from all ages. We don't turn anybody away for ability to pay. Phone number is 401-615-2800, and you can schedule an appointment today. All right. Thanks for being here, Sara. Thanks a lot.
It was nice talking with you. Thank you.
You too. Take care. Bye.
Bye.